Now moving on to the next topic, guys, let us discuss about the tarsal bones, all the tarsal bones present in the foot, and then their arrangement, how they are arranged. And then we're actually going to study about the most important topic, that is arches. Like what is forming the arches of the foot, guys. So first, starting with the tarsal bones, there are totally like 7 tarsal bones. And first of all, this big one that you're able to see, which is going to form the heel region, that is nothing but calcaneus bone. And above the calcaneus, you'll be actually able to appreciate the talus. Right in front of the talus, there will be a boat-shaped navicular bone. And lateral to navicular, there will be cuboid. Remember, the cuboid is actually towards the lateral side. And then you actually have got 3 bones. Together, they are known as the cuneiform. So there will be a medial cuneiform, there will be intermediate cuneiform, and the lateral cuneiform. So 3 cuneiform, 1 cuboid, that is 4, and then the navicular 5, and talus will be the 6th one, and finally the calcaneus will be the 7th one. So there are totally 7 tarsal bones, and further you'll be able to find the metatarsals like the first, second, third, and fourth and fifth metatarsal. So let us do one thing. Let us first of all draw the diagram of all these 7 tarsal bones here, so that you'll be easily able to identify in the image-based questions. The first, you imagine this one here to be your talus. This is the talus here, guys, and that big one which is going to form the heel, it is the calcaneus bone. And right in front of the talus, there will be a boat-shaped bone, and that one will be the navicular. And then in front of the navicular, you'll be able to appreciate the 3 cuneiform bones, and laterally you'll be actually having the cuboid. So laterally this one will be the cuboid, and medially you'll be actually having the 3 cuneiform bones, guys. And I don't have to tell you that there will be a medial cuneiform, then there will be intermediate, and then there will be a lateral cuneiform. So 3 cuneiform, cuboid, navicular, talus, and calcaneus. And in front of that, you'll be able to appreciate the metatarsals, guys. The first metatarsal, the second metatarsal, and then the third metatarsal, and then the fourth one, as well as the fifth metatarsal here. So this is how the arrangement will be there. The first, second, the third, and the fourth, and the fifth metatarsal. Later on, we'll be actually having the phalanges not needed to be actually drawn here. Now, once you are comfortable with all this arrangement over here, guys, now the most important thing is, what about the arches, where most of the students will be having a confusion right from their first year onwards. The medial longitudinal arch, the lateral longitudinal arch and all. Guys, what you have to do is, before starting with the arches of foot, first try to understand like what is exactly the use of this one and what are the arches exactly, and then later on we'll go for the medial and the longitudinal arch. So what is exactly this one? Remember, our foot, when you observe our foot is not at all flat. In fact, if there is a flat foot, that is actually an abnormality. It is not flat like this, it is actually arched, a bit arched. And that arch will actually help you in walking along that rough surfaces, like climbing on the mountains and all. At our home, we are having like beautiful flat floor here, having tiles, marble and all. You'll be able to easily walk. But when you're climbing on the mountain, there will be uneven surfaces, and on these uneven surfaces, it will be actually helping you in walking properly. Fine, it is actually arched. Now there are like for example, if you are able to see the foot here, the foot will be arched a bit, and there will be a medial longitudinal arch here, and then there will be lateral longitudinal arch. And when you compare both of them, the medial side and the lateral side, medial longitudinal arch is like more arched there compared to the lateral longitudinal arch, guys. Okay, and now we have to see all the components of that, which bones are going to form that arch. Whenever there is an arch, there will be highest point, and that highest point is actually referred to as the summit of the arch. So we have to decide, okay, which bone is going to form the summit of the arch, and then not only that, which tendons are going to maintain the arch, which tendons are going to lift that and maintain that arch, and which is going to form the tie beam, the sling, everything we need to learn about this one, guys. So let's get started. On one side, let's write down about the medial longitudinal arch. And on the other side, let us write down about the lateral longitudinal arch, guys. So there will be a medial longitudinal arch, and then there will be a lateral longitudinal arch, guys. Now first, what are the bones which are actually going to form the medial longitudinal arch? which bones are going to form the medial longitudinal arch. It's quite easy from our diagram here. Medial longitudinal arch is formed by, on the medial side you are able to see the calcaneus, number 1, number 2 talus, number 3 navicular, and then all the 3 cuneiform, okay, and then the first, second and the third metatarsal. So whatever I have just represented with red color over there, all of them towards the medial side are involved in the formation of that medial longitudinal arch. So let us just write down the names of all these bones here. The medial longitudinal arch is formed by calcaneus, talus, and then in front of talus navicular. In front of navicular all the 3 cuneiform, and then first, second and third metatarsal. So these are all the bones which are contributing for the formation of medial longitudinal arch. Similarly, what about the lateral longitudinal arch? Whatever is left out there, guys, again on the lateral side, let me just represent it with another color here. On the lateral side again there is a calcaneus, and then there will be cuboid, and then the 4th and 5th metatarsal. That is the one which is involved in the formation of lateral longitudinal arch. Lovely, it's easy now. So lateral longitudinal arch is again formed by calcaneus, cuboid, as well as the 4th and 5th metatarsal. So I hope if you draw the diagram along with me, you don't even have to mug up this one, guys. The moment you draw the diagram of all the arrangement of bones in the foot, then it will become easy for you to remember which bones are going to form the medial longitudinal arch and which bones are going to form the lateral longitudinal arch. Now, once you are comfortable with the bones here, the next thing that you have to learn is about the summit. Now, it is not at all like a difficult English over here. It's not like something like great science. So, once you understood the name, like what is the meaning of summit here, guys? Summit is nothing but the highest part or the highest stone that will be placing in the arch. In the same manner here, whatever arch is formed in the foot here, the medial longitudinal arch, what is going to form the summit here, the highest weight bearing bone. Now, when you see towards the medial side, on the medial side, the summit or the highest bone will be formed by talus, and in the lateral longitudinal arch, the highest one will be actually the calcaneus only. So, in the medial longitudinal arch, the summit is actually formed by the talus, and in the lateral longitudinal arch, it is formed by the calcaneus only. Now, once you are done with the summit here, the next thing that you need to learn is about the joint. What is the joint? What is the main joint which is involved in this medial and the lateral longitudinal arch? Now, this diagram, guys, it's going to help you a lot, I'm telling you. In the medial longitudinal arch, there will be a joint between the navicular bone and the talus bone and the calcaneus bone here. I repeat again, in the medial longitudinal arch, the main joint which is involved here will be between the talus, navicular and the calcaneus. First, try to remember the name of that and try to remember the name in the clockwise direction there, guys. That is talus and the navicular and then the calcaneus. So, talo-calcaneo-navicular joint. I have observed like most of the students are very much worried about remembering that big name. So, it is like talo-calcaneo-navicular joint. Go in a clockwise direction. So, what is the main joint which is involved in the medial longitudinal arch here? That is talo-calcaneo-navicular joint. Now, not only the name of the joint, guys, you actually have to even remember the subtype of this one, and that is also something interesting here. Why? Because talo-calcaneo-navicular joint is actually one of the examples of ball and socket joint. Now, you ask any student, any medical student, ball and socket joint, the only two examples that will come in the mind will be the shoulder joint, another one will be the hip joint. And in the PGME exams, they will never test you on that one. It is so simple, every student knows that. Shoulder joint and hip joint are definitely ball and socket joint. Now, you have to be always ready with other examples, which usually the students will forget. So, one of the examples is talo-calcaneo-navicular joint. So, it is example of ball and socket joint. Then, sir, what about the lateral longitudinal arch now? The lateral longitudinal arch, the joint that is involved here will be between the calcaneus and the cuboid. And this is like very simple. That is nothing but calcaneo-cuboid joint. Calcaneo-cuboid joint. Fine. So, the medial longitudinal arch, the main joint that is involved is talo-calcaneo-navicular joint, ball and socket type, and calcaneo-cuboid, the lateral one, sir, the lateral longitudinal arch joint of that. Then the next one that you have to remember about the ligament, guys. Which ligament is mainly supporting these two arches? The medial longitudinal arch will be actually supported by spring ligament. It is maintained by the spring ligament. Whereas the lateral longitudinal arch, it's very simple here, will be having like short and long plantar ligaments. So we are learning about the arches of the foot. So which region are we in right now, guys? We are in the plantar region only. So there is nothing but short and long plantar ligaments. So medial longitudinal arch is actually maintained by the spring ligament, whereas the lateral longitudinal arch is actually maintained by short and long plantar ligaments, guys. So let me just teach you a little bit more regarding the spring ligament. Most of the time it will be asked in the exams, guys. So let us just go to this diagram here. Now look at this atlas image over here, guys. In this atlas image, this bone above here will be your talus, and this bone here will be the calcaneus, and in front of that there will be actually navicular, that boat shaped. And you can very clearly appreciate there, calcaneus and navicular, they are the one which are going to form a socket below. And into that, what is going to happen? The talus acting like a ball. So talo-calcaneo-navicular joint is like ball and socket joint. You'll not forget that one. And from that time, I have been telling you, try to learn the name in the clockwise direction. So what do I mean by that? Yes, starting from here, talus, actually go towards like calcaneus and then navicular. So don't get confused how to remember the name. It is talo-calcaneo-navicular, ball and socket. Now, once you are comfortable with this one here, the next thing that I want to teach you here is this calcaneum bone. It is having one evagination here, which is known as sustentaculum tali. I hope you're able to appreciate here. Let me just highlight with some color here. This one is sustentaculum tali here, guys. The calcaneus bone is actually having sustentaculum tali. Now, the problem with many students is that they'll be thinking, looking at the name tali, they'll think that it is a part of talus. No. It's actually supporting, suspending the talus above. That is why the name is given as sustentaculum tali. But remember, it is a part of your calcaneus bone. We are comfortable with the name right now. So from here, we understand that sustentaculum tali is a part of calcaneus. Now from there, I am able to see one ligament. That ligament will go and get attached to navicular bone over here, guys. There is a ligament that is getting attached to navicular bone. So that ligament is from the calcaneus part to the navicular. That's the reason why it is known as calcaneo-navicular ligament. Very simple. Calcaneo-navicular ligament. And that ligament, the another name of that ligament itself is spring ligament. And you can clearly see that's the medial aspect of the foot. And that is the ligament which is supporting your medial longitudinal arch. So the ligament which is supporting the medial longitudinal arch will be spring ligament. And spring ligament, another name of that ligament is calcaneo-navicular. It is between the calcaneus and navicular. So spring ligament is also referred to as plantar calcaneo-navicular ligament. Spring ligament is also referred to as plantar calcaneo-navicular ligament. Plantar calcaneo-navicular ligament, guys. And lateral longitudinal arch is just maintained by, or the ligaments which are supporting that are short and long plantar ligaments. Now once you are done with the bones, once you are done with the summit, the joint and the ligament, the next thing will be the sling. What is going to form the sling of these two longitudinal arches, the medial and lateral longitudinal arches? First, you try to understand what is the meaning of sling here, sir. For example, if this is the foot, above the foot there will be leg region. From the leg region there will be a muscle coming here, and the tendon of that will be inserting in the foot. And not only inserting, that is the one which is going to pull and maintain that arch. So that arch is maintained on either side, the medial longitudinal arch and lateral longitudinal arch, that is maintained. It is maintained as like arched with the help of the tendons coming from the leg region, and that is said to be the sling. Try to understand the meaning first of all. What is the meaning of sling there? So slings are those which are helping in maintaining the arch there. Now try to recall from our previous topics that we have studied in the lower limb. On the lateral side, which two muscles will be having, which will be helping in eversion of the foot? Eversion of the foot is done by which one, guys? That is nothing but peroneus longus and peroneus brevis. And similarly, what are the two muscles on the medial side which is helping in inversion of the foot? And that is nothing but your tibialis anterior and tibialis posterior. Okay, so therefore the medial longitudinal arch, the sling for the medial longitudinal arch which is going to maintain that will be your tibialis muscle. So one will be the tibialis anterior, Another one will be the tibialis posterior. And another one more thing that you have to remember here, just add there, that is flexor digitorum longus also. The tendon of flexor digitorum longus. These are all maintaining the medial longitudinal arch. The arch is maintained by them. Then what about the lateral longitudinal arch? That will be peroneus longus and peroneus brevis. The lateral longitudinal arch is actually maintained by the peroneus longus and peroneus brevis, guys. That is acting like a sling for the lateral longitudinal arch. Now, in this one also, like I have observed in the exam, they are asking about the major one, the sling for the medial longitudinal arch. I wrote there 3 tendons, but out of the 3 of them, the major one, the main one will be tibialis posterior. And similarly, for the lateral longitudinal arch, the main sling will be actually the peroneus longus. Peroneus longus will be the main one, which will be acting like a sling for the lateral longitudinal arch. Then the next one will be tie beam. What will be acting like a tie beam, sir? Now, by the way, what do you mean by tie beam here? It's all about, you have to imagine about arch, guys. For example, if this one is your arch here, you remember that arch and above arch. Now, tie beam means the one which is connecting the anterior most part with the posterior most part of the arch. So, if this is your foot and it is arch, and if this is the medial longitudinal arch, tie beam is the one which is connecting the anterior most with the posterior most one. That is a tie beam. And it will be, of course, for both the arches, it will be nothing but aponeurosis only, the plantar aponeurosis. So, whether it is a medial or longitudinal arch or whether it is lateral longitudinal arch, it will be same plantar. Aponeurosis will be acting like a tie beam. Plantar aponeurosis will be acting like a tie beam. So, I hope it is not at all that difficult topic. Unnecessarily during our first year MBBS days, we will be like confused with the medial longitudinal arch, the lateral longitudinal arch, which bones, what is the summit and all. It's so simple terminology here, guys. All these are the structures which are actually involved in the formation of medial and the lateral longitudinal arches here. Bones, the summit, the highest one, the joint, the main joint which is involved here, and then the ligaments, and then the sling, and then finally the tie beam. I hope this makes the topic of longitudinal arches, medial lateral longitudinal arches easier, along with all the tarsal bones, guys. That's all. Done with this topic.